Good evening, and thank you very much for coming to our lecture on inequality by Professor Richard Wilkinson and also Professor Tony Griffin, who will be speaking and helping us to raise some of the issues. My name is Don Robotham, and I'm a professor of anthropology here, and I'm director of the Advanced Research Collaborative, which is sponsoring the event. And the Advanced Research Collaborative, just to be very brief, has been established to promote interdisciplinary research at the Grad Center. And in so doing, we're trying to identify some critical areas of support for interdisciplinary research, of which the area of inequality is a principal focus. And when we say that, we don't mean that it will be one event or two events, but as a continuous feature of the research activities of the Graduate Center. So we're very happy this evening to have as our guest Professor Wilkinson, who is Professor Emeritus of Social Epidemiology at the University of Nottingham, and who is the author with Kate Pickett of the very, well, shall I say, famous book, The Spirit Level. And Professor Michelle Fine, who's Professor of Social Psychology, Women's Studies, and Education here at the Graduate Center, and Professor Tony Griffin, who I believe is head of the Max Bond Center on Justice for the City. Close enough. Yes, I tried to get, but of course I knew I'd get it wrong. But we're very happy to have them here to discuss this absolutely critical issue of inequality and what are the sources of it, how does it express itself, and how we should understand and, of course, act to bring more equal justice to the society. So without any further ado, let me invite Professor Richard Wilkinson Michelle Fine to introduce the speakers, and then we will proceed. I'm sorry. Thank you.
Good evening. I'm Michelle Fine. I want to begin by thanking Don for his leadership on the Inequality Initiative, and Rachel Liebert, Alida Rojas, and Eben Sweeney for helping to facilitate tonight. I'm going to do very brief introductions. If you're if you work here or you're visiting here, you know that inequality is not news to those of us at the Graduate Center, although if you picked up the Times today, in the upper left-hand corner, you'll notice woes for the non-wealthy, as though that is news. We didn't need Hurricane Sandy to reveal the fault lines of inequality, but he did very well. I'm a little tired of her being called a she. Those of us who live and work in New York, according to Professor Wilkinson, win as the #1 on the inequality trifecta. I think we live in one of the most, if not the most, unequal nations in the world. We live in one of the most unequal states in the country. We live in one of the most unequal cities in the state. And if there are still any working class or poor people left in Manhattan, we are probably the most unequal borough in the city. At the same time, those of us in the Graduate Center understand that we not only theorize, study, document inequality, but we also occupy, protest, write legislation, and when necessary, take to the streets. That is, we understand public education as a responsibility to widen the public imagination for what could be, even as we critique what is. So to begin our conversation tonight, I'm really thrilled that we have two stunning scholars who very much embody the commitments to study and act on inequality. I'll begin with Richard Wilkinson. As Don indicated, Richard is studied economic history at the London School of Economics, and he is a professor emeritus in social epidemiology at University of Nottingham Medical School. He wrote The Spirit Level with Kate Pickett in 2011. That book won the Political Science Award for Publication of the Year. In 2010, it won the Bristol Festival of Ideas Prize. He's co-founder of the Equality Trust. He's a consultant to the UN Project on Bhutan, Well-Being and Happiness. If you go online, you can watch his TED Talk, but you're going to get much of it in person tonight. And if you go on the Equality Trust website, you'll see a whole set of strategies that they've been using in the United Kingdom to agitate and advocate for equality, including making public the ratio of the CEO and the lowest paid employee in a variety of companies, including making public that civil servants not have living wages so much above where the lowest in their organization has wages, including only hiring contractors to work with public agencies that also have very low inequality gaps in incomes. So I've seen Professor Wilkinson. He's been incredibly, to speak CUNY for a moment, he's been incredibly menschy. You're all with me? He has schlepped around the city with me to visit the School of Social Welfare, to lecture on criminal justice. He spoke at the School of Public Health. This morning we were up at City College at Tony's Institute. And he's just been generous to meet with psychologists and educators and anthropologists, as well as the Luxembourg Income Study, because he is actually committed to us understanding deeply the inequality framework that he's offering us. And when we heard that Dr. Wilkinson agreed to join us, he was really remarkably generous. When we asked what his fee was, he said, please just donate the money to the Equality Trust. And he said, just give me 3 or 4 talks in a day, right? Because he didn't want to have too much of a carbon footprint, and he didn't want to get too jet-lagged. And we have exploited him just as he had asked us to do. So I thank you for that, Richard. And then we're joined by Tony Griffin. Tony is professor and director of the J. Max Bond Center for Architecture at the Spitzer School of Architecture up at City College. She runs the Center for the Design of the Just City. She has an active practice in urban planning and design. She's been involved in reimagining both Newark and Detroit. From 2000 to 2006, she was vice president of development for Anacostia Waterfront. She's been at the Harvard Graduate School of Design. These are 2 of the finest scholars and practitioners that I could imagine. These are classic CUNY speakers who I like to think of as scholars who write in the subjunctive. That is, they get us to imagine what could be, even as we critique and deal with what is. Professor Wilkinson.
Actually, Michelle had it quite the wrong way round, as if it was her to thank me. I've got the best of this deal to be given a week in New York talking about my obsessions to a great range of people. And normally you have to pay some psychiatrist to talk about your obsessions. So I've been talking about it to many more people. And it really is an obsession of mine. I've thought about rather little else for about 35 years, actually. And now I'm married to my co-author, and so we can talk about it at 3 o'clock in the morning. So I've been working on stuff around inequality for so long because I started off working on health inequalities, which in many ways, you know, the huge social class differences, the differences in health between rich and poor, well-educated and badly educated, you know, you find those, well, in some countries as big as 10, 12, 14-year differences between the richest and poorest neighborhoods, differences in life expectancy. That's the biggest human rights abuse, I think, in rich developed societies. It's, in some ways, it seems to me worse than locking people up without trial to deprive them of that length of life. And of course, the morality, the ethics of it change because, you know, in the past, we didn't really know that these differences existed or didn't know how large they were, and certainly didn't know what kinds of things might alter them. But of course, as our knowledge grows, the moral responsibility changes. And I think the contrast between the material success of our societies and the many social failings has bothered people. It's been a sort of something that people don't really address, but I think people feel uneasy about it. And we blame teachers, or we blame lack of religion, or we blame parents, or whatever, none with much evidence. But basically, my message is contained in this one slide. I'm going to show you that again and again and again, with slightly different labels on the axes, but always income inequality along the bottom and some problem up the side. It really is as simple as that. I suppose I've always had an intuition, as many people have, that inequality is divisive and socially corrosive, but I never thought that we would actually see the effects of different amounts of inequality in different societies. Our book, and I'm really just going to summarize what's in it, but I think we've got a bit more perspective on it, having talked about it rather a lot of time since it came out. So, in some ways I wish we'd written it a bit later when we'd got it in perspective a bit more. But people have sometimes called it a theory of everything, because we talk about life expectancy and mental illness and teenage births and the proportion of population in prison and scale of drug abuse and child well-being and social cohesion and quite a number of others. But it's not a theory of everything. It's a theory of problems that have social gradients, become more common at the bottom of the ladder. They're not absent at the top. I mean, ill health, depression, drug abuse, violence all exist at the top of society. They just become more common further down society. And I think you can look at those social gradients, and probably most people think it's just a sorting of the population. The vulnerable move down and the resilient move up, and that's why we have social gradients. But I'm going to show you those problems are, the problems with social gradients, anything from 2 or 3 times as common to 10 times as common in societies with bigger income differences between rich and poor. And I think our thesis, our central idea, is that reflects that means that these problems are substantially responses to social status differentiation itself. That income, material standards are not so much in the rich world important in themselves anymore as important as signals of social status. I want to start with this. This slide just shows national income per person along the bottom and life expectancy up the side. I know it looks like smoke from a factory chimney to most of you, but these are the names of countries, not ash. And what it shows is a very rapid rise in life expectancy in the early stages of economic growth, and then a leveling out. Life expectancy goes on rising, but that's because that curve moves up over time, not because we move out along the given curve. I mean, the rich countries are here, the USA, one of the richest is out there. But the interesting thing is, if you, instead of having life expectancy there, if you have well-being or happiness, it looks very much the same. Rapid rises, rapid improvements in the early stages of economic growth, and then a leveling out. And I think that what that means is that although economic growth is what's transformed the real quality of our lives, it's largely finished its work. If you look at measures of well-being over time within our societies, you can look at over a period where national income per person doubles. You can look in societies where even the poor have had rises in the standard of living. And you find actually that measures of well-being are flatlining. So I think that's, of course in poorer countries it's really important to raise material standards, But for us in the rich world to have more and more of everything makes less and less difference. And that's a crucially important thing to recognize as we become aware of the need to deal with climate change and carbon emissions. But I'm going to talk just about those rich developed countries on the flat part of the curve. We chose those simply because we thought it'd be more easy to get comparable data for them. Also because we were trying to write something very, very simple and clear, and we didn't want to go into technicalities of controlling for national income per person or anything like that. And so we just took the 50 richest countries in the world, left out the ones that were less than 3 million population because we didn't want tax havens, and ended up with about 24 countries for which there is good comparable income distribution data that we could download from the UN or the World Bank. So I'm just going to expand that little bit at the rich world. So still life expectancy against GNP per capita, but here you see Norway and the USA, twice as rich as Israel, Greece, and Portugal on the left, and it makes no difference to life expectancy at all. It's not just that it's not a statistically significant relationship, there is nothing there. But you all know that health is worst in the most deprived areas. There's a close correlation within our countries between income and death rate. So these are median incomes of the zip code areas, the richest ones on the right with the lowest death rates, and the poorest ones on the left with the highest death rates. This is the pattern of inequality I mentioned at the beginning, health inequality. But it's not a difference between the poor and the rest of us. You know, if you want to understand health inequalities, there's no good thinking just about the homeless and the unemployed. You have to have a completely different framework in order to explain why the people just next to the richest do worse than the richest. And that actually is part of the reason why we began thinking about social status itself as important. But that contrast between income not meaning anything very much between our rich societies, but being so important within them, the implication, I think, the explanation of that paradox is within our societies we're looking at the effects of relative income or social status, social position, where we are in relation to each other. And I think as soon as you've got that idea, we need to start thinking what happens if we make the differences between us bigger or smaller. And that's really what I'm going to talk about. The data we use is nothing hypothetical, no perfectly equal imaginary societies, but simply the scale of how much richer the top 20% in each country than the bottom 20%. The UN Human Development Report website has a couple of different measures, and this is the one we thought people would understand most easily, so we downloaded that. And you see in the more equal countries on the left, the top 20% are getting 3.5 or 4 times as much as the bottom 20%. But on the right, where we have countries like the UK, Portugal, USA, Singapore, the gap is twice as big. On that measure, twice as unequal. And that's a really substantial difference between our societies. And it's that difference that allows us to get some idea of what effect inequality might have on our societies. So we collected internationally comparable data. When I say collected, I mean we didn't put it together. We just looked to see what the life expectancy was on the WHO data, what maths and literacy scores for each country were on the OECD data. I can't remember where homicides come from. Trust, I remember, was the World Values Survey. Obesity from the International Obesity Task Force. Mental illness comes from WHO, and social mobility from studies by people at the London School of Economics. We never decided what data was comparable with what. We just left that to other people. But you see, those are the main problems we could find, social issues which have social gradients that we thought we'd find internationally comparable data on. And we put them together in one index. And here is that index. So where our country is its sort of average on all those things, influenced just as much by life expectancy as by social mobility and so on. Along the bottom, you've got the measure of inequality I've just shown you. How much richer is the top 20% than the bottom 20%? And there's that astonishingly close relationship. Looks like something out of physics with a bit of measurement error. And you see the more unequal countries, USA, Portugal, UK, on the right, doing so much worse than the ones on the left, the Scandinavian countries, and in our data, Japan. But if you look at that same index, exactly the same figures for each country up the side, in relation to national income per person, there's no relationship at all. We were worried that, I suppose we knew that we'd get attacked, and so we were a little bit careful, trying to think what kind of attacks. And one of the things we thought of is that people would think we'd chosen these problems to suit our argument rather than because they're the more important problems with social gradients where you can find ready-made internationally comparable data. So we decided also to look at the Unicef Index of Child Wellbeing. It's made up to measure child well-being in rich countries, and from our point of view, its advantage is that we had nothing to do with how it was compiled. In fact, it has 40 different components, measures of child well-being. So it includes whether kids can talk to their parents, whether there's bullying at school, what immunization rates are like, all sorts of things like that. And here it is in relation to that same measure of inequality. The more unequal societies having lower levels of child well-being. But look at that same index of child well-being in relation to national income per head. No relationship again. Although we talk about the importance of child poverty, we really should distinguish between relative poverty and absolute poverty. The data is absolutely clear. We did a paper in the British Medical Journal on this UNICEF index, looking at each of its components in relation to inequality and average income. And insofar as we could, we did it for the American states as well. We looked not only at this group of countries internationally where we could make good comparisons, and I'm pleased in a way that they are the old market democracies, so they're much of a muchness, it facilitates comparison. But we thought people would say this is they'd ignore the levels of statistical significance and just say this is some kind of fluke. So we used the American states as a separate test bed, so we could look at these relationships in two independent settings, asking just the same question: do the American states with greater inequality do worse on these things? And the picture is extraordinarily similar. The more unequal American states, the things that are related to inequality internationally are also almost always related to inequality amongst the American states. I'm going to show you a few examples of the components of our index. So this is from the World Values Survey as a measure of whether the proportion of the population who agree that most people can be trusted. It's widely used as a measure of social cohesion. And you see on the right-hand side, the more unequal societies, it falls to perhaps 15 or 20% of the population feeling they can trust others. But in the more equal societies, it rises to 60 or 65%. And I do think that, there are now a number of analyses of this kind of relationship using different data. Also, if you look at Putnam's measures of social capital, both in his Bowling Alone for the American states and his earlier study in Making Democracy Work of the regions of Italy, and in that book he has a footnote saying but only a footnote, saying there's a 0.8 correlation between his measures of social capital and income inequality in the regions of Italy. And I do think that, if it makes such a difference to the whole feel of what it's like to, I don't know, walk home alone at night in a major city. You'd feel much safer in one of the more equal countries. But I think it makes other important differences as well. The same data, basically, for the American states looks very similar, similar scatter, same basic story going on there. This one is mental illness. WHO, this is not people going to their doctor and wanting antidepressants or being hospitalized for having a nervous breakdown or something. This is, that would be too influenced by how people access medical care and whether you have to pay for going to your doctor or whatever. WHO put this data together to allow us to make good comparisons of levels of mental illness in each society using diagnostic interviews on random samples of the population. So, you know, there are problems comparing levels of mental illness, but I think this is as good as you can get. And the differences are enormous. I mean, here you've got about 8% of the population who had any mental illness in the preceding year. And up here, it's sort of 3 times that level. This is any mental illness, but if you look at serious mental illness, it's a similar picture. You can look at separate components a bit, and I seem to remember that the most closely related component is anxiety. This one is infant mortality. I like to point out on this one, this line of best fit, the regression line, you can see to go through most of the points, it should be a good bit steeper. It isn't, because it's being pulled down by Singapore there. People on the far right from, I can't remember what the organizations are called now, but anyway, they have suggested that we've manufactured these relationships by picking and choosing data. In fact, that Singapore figure, I never believed it. But we have an absolute rule that if our data source has data for one of the countries we're looking at, it goes into the analysis. I've since found that Singapore, one of the really important reasons why their infant mortality appears so low is that because they're a city-state, they do not want people to gain Singaporean nationality. They can't afford the population to get much bigger. And you do that. You gain nationality by marriage or by being born there. And so the 25% of their population who are migrant workers, usually the poorest 25%, are not allowed to have babies and they're not allowed to get married. They get health checks every 6 months, and if they're married or pregnant, they get sent home. So you remove from the picture the 25% of the population where you'd expect infant mortality to be highest. But I just point that out because some people find the data so surprising that they're suspicious. But that graph is exactly as in our book. This is somebody else's data on Daly and Wilson, who spent a great deal of their career working on environmental influences on rates of violence, and one of the big issues is inequality. The red dots are American states, the blue triangles are Canadian provinces, and you see that you've got about a 10-fold difference in homicide rates. 15 homicides per million population would be there, and you've got 150 there. There are now a great many papers on this, about 50 papers in the literature looking at this relationship in different settings. So it's a pretty robust relationship. This one, imprisonment. I should point out that up the side is a log scale, which means the difference from 1 to 10 is the same as from 10 to 100 or 100 to 1,000. And if it wasn't like that, if it wasn't a log scale, this would curve up off the top. The scale of the differences is a bit harder to judge because the intervening numbers on the log scale are always a bit higher than you'd expect. So 40 would be about there. So this goes from around 40 to 400 prisoners per 100,000 population. Again, a tenfold difference in the proportion of the population locked up. And most of that difference is not due to more crime. A bit of it is more crime, but most of it is more punitive sentencing, longer sentences, harsher sentences. But also you can see the prison regimes are harsher in the more unequal societies. And I think amongst the American states there's a slight tendency for the more unequal ones to retain the death penalty. I don't know whether that's more fear up and down the hierarchy in more unequal societies or less empathy or whatever, but I think it's part of the picture that in more unequal societies something goes wrong with the quality of social relations. And I do think what the data is really showing us is that intuition from, the liberty, fraternity, equality idea, the intuition that inequality is divisive and socially corrosive is absolutely true. And I often wonder to myself why, when I have always had that intuition, I never thought to look in the data. I think I imagined that a perfectly equal society would feel different, but we all live in class societies with hierarchies and so on, and I never thought the differences would be big enough to see an effect. And indeed, I think one of the oddest things about our book is somebody else didn't write it 10 or 20 years ago. And I think that really needs an explanation. There are probably tens of thousands of people doing social research of different kinds around the world. I keep on wondering whether there's some kind of denial that these status issues are so important to us that we mustn't recognize them. We must all the time pretend that, they're not the awkwardness of class and social hierarchy and superiority and inferiority. It's really too embarrassing and awkward when it gets into face-to-face relations. This one is teenage birth rates. The differences aren't so, well, yes they are, sorry. This is the one with quite big differences again. This is births per 1,000 women in their teens, and it goes from a bit below 5, but there's 5 births per 1,000 women in their teens. We have the record in Europe, you in the developed world. So overall, tenfold differences. You've got the idea. There are costs to inequality. I'm going to end just showing you that pattern before I go on to trying to say what's going on behind the data with this issue, because I think social mobility is really important. Because many people say the huge inequalities in outcome are acceptable if everyone can find their appropriate level in society. But actually, as you might expect if you really begin thinking about it, social mobility, you might think that social mobility would be slower in more unequal societies. There are more obstacles to get up. I think more social prejudices, more what I call downward prejudices in more unequal societies. The measure of social mobility is simply a correlation between fathers' and sons' incomes. I'm sorry, it isn't mothers and daughters, but there are complicated reasons why that's so. And we published this data when there were even fewer countries in the analysis than that, because we knew that USA and UK social mobility had slowed while our income differences widened. But I think about 6 months ago, Alan Kruger, the president of, the chair of Obama's Economic Advisory Panel, produced this graph on quite separate data. The line slopes the opposite way because, we decided to plot it so that lower social mobility, the line got lower. But as it's based on a correlation between father and son's incomes, the high correlations, meaning father's income is even more important, he plotted it going upwards. But that's quite independent data telling exactly the same story. Less social mobility in more unequal societies. Father's income is more important. And it's really asking, do rich fathers have rich sons and poor fathers have poor sons?
Which years is that?
I think they are years around the early 2000s. There are two dates. Because it's intergenerational social mobility, it uses the big cohort studies where samples of the populations in each country have been followed up from birth. And what they do is take the father's income when a son is born and the son's income 30 years later. And the 30 years later, I think, was usually in the early 2000s, but it depends on the cohort dates in each society. So we've looked at a number of things with social gradients. That's a sort of brief list. I want to come back to this where we put it all together, basically to point out that, you know, in more unequal societies, it's not just one or two things that go wrong. It's a huge range of these problems with social gradients. It's a general social dysfunction that we're seeing. And indeed, if you want to try and explain it away some way, you've got to have some reason for saying a whole range of apparently unrelated problems are all worse in some societies and better in others. And so if you argue that it's reverse causality, you've got to explain why all those things move together in some strange way. I think you shouldn't look at it and say maybe it's cultural differences. First, if you look at, if you take off the English-speaking countries, USA, UK, New Zealand, Australia, you've still got a statistically significant relationship down here. You can take away about 2 or 3 countries each end simultaneously, and you've still got the relationship. But of course, as I said, violence and inequality have been looked at in so many different settings. In 2006, we reviewed 168 papers looking at population health in relation to inequality, and there are now about 200 of those. So even the provinces of China that are more unequal have worse health. So I don't think it's worth seeing if you can explain it away here. Another thing I'd like to point out is that look at Sweden and Japan. I must say there is some controversy about whether Japan's income distribution is as equal as that. And if you look at the OECD data, Japan appears as much less equal. But we reran all the correlations, and they're on the Equality Trust website, and it doesn't make very much difference. But anyway, Japan and Sweden, their level of inequality comes from quite different sources. Sweden has very large differences in earnings and reduces the gap through high taxes and generous welfare spending. Japan, always in the past, it had much smaller differences in earnings before tax. We find a little bit of the same contrast between some of the American states that do well. So we conclude that it doesn't perhaps matter how you get your greater equality as long as you get there somehow. And actually I think that if you win more progressive taxes and benefits, the danger is that the next administration that comes along can undo it all at the stroke of a pen. I think much more fundamental is to try and reduce the income differences before tax. I've been pointing out the scale of the differences. I think while I explain this, I've been pointing out the scale of the differences, you know, sometimes tenfold differences in outcomes or the threefold differences in mental illness, because those differences are too big to be explained simply by an effect of inequality on the poor. The differences are so large because we're all affected. Unfortunately, there are a number of studies that allow us to compare people at each level in the social hierarchy and see how those people at that level do in a more and less equal society. So this is an early attempt to compare health inequalities internationally. And to make a really good comparison, Swedes reclassified a number of their infant deaths by our British occupational class classification. Anachronistically, it's a classification by father's occupation, so single mothers have to go in a group on their own. But then here, the low father's occupational class is unskilled manual workers, then semi-skilled, skilled manual, junior non-manual, clerical workers, intermediate non-manual, teachers, nurses, so on, and the professional occupations plus directors of larger companies and things like that there. But you see, Sweden does better right across the board. The differences are biggest at the bottom of society, but even at the top, they have a small advantage. In our book, I think we show 5 examples of this in different settings and different outcomes. But the picture seems to be fairly constant, that inequality makes a difference to the vast majority of society. We can't talk about the super rich who are a fraction of 1% because we don't have separate data on them. But we can say that 95% of the population seem to benefit from greater equality. And we were using just the simplest illustrations because we wanted to get this stuff outside the academic arena, if you like. But if you look at some of the work that, for instance, a meta-analysis of multi-level models of the relationship between inequality and population health, where you control for individual income, the effects of individual income on health throughout the society, you find, well, colleagues at the Harvard School of Public Health doing that kind of work talked about inequality as a general social pollutant because its effects are not confined to the poor but go so far up the income scale. So that's why the differences are sometimes so large. I think that what we're really looking at is really whether the social pyramid is a steep one like that or a much shallower one like that. I don't think you should think of income inequality as a new determinant of health or any of these other outcomes. I think it's telling us more about the social hierarchy, and in fact I think what it's doing is driving how steep the social hierarchy is. I think bigger material differences give rise to bigger social distances and more feelings of superiority and inferiority. And, you know, I think the evidence is fairly clear, not only from sociologists like Bourdieu, who talk about how we use income to express social distinctions, but also from data that shows in more unequal societies, people work longer hours, they save less, they spend more, they get into debt more. You know, people are using their incomes to show what they're worth. And I do think there is a bigger sense of, well, that we judge each other more by social status in more unequal societies. And so there's more status competition, more status insecurity, more worry about how other people judge you. You know, the fears that maybe people think you're stupid or socially gauche or whatever. I think this is also about whether people feel valued or devalued. That's another way of looking at the same thing. You know, huge income differences, 300 or 400-fold differences within a multinational company. There's no more powerful way of telling people at the bottom they are almost worthless than to pay them a third or a quarter of 1% of what the CEO gets. I think this gets right into our personal life and makes us all more neurotic and twitchy about, you know, all these fears of inadequacy, of how we're seen and judged, as I said, self-esteem, social anxieties of different kinds. Yeah, the big change in our understanding of public health is how important psychosocial risk factors are. And the main groups are low social status, any measure of friendship. Friendship is highly protective of health. many studies showing it's a really powerful influence on health. And then stress in early life, maternal stress in pregnancy, the social environment, the quality of care in early childhood. And those three things, I think, are telling us about the same basic problem of how we negotiate social relationships. I mean that the anxieties, insecurities, feeling not valued that you can have from low social status are rather like those similar feelings that you might have from a difficult early childhood, not being valued, insecurity, anxieties, and so on. And friendship fits into that, because if we've got friends, that people like you, they value you, they seek out your company. But if we feel excluded, ignored, avoided, we all know those feelings immediately of maybe I'm boring, socially gauche, unattractive, and we're all extraordinarily vulnerable to those kinds of feelings. So I think in a way what the social epidemiology through these risk factors is telling us is that those are the most important stressors in modern societies. Of course, losing your home or something like that is a much more powerful stressor, but fortunately, not so many people suffer it, whereas these we all know rather well. And we now know how chronic stress affects the immune and cardiovascular system and so on. We know also that the most powerful influences on stress hormones like cortisol in experiments, many experiments done in different psychology departments around the world, show that the most powerful influences on our levels of stress hormones are tasks that include what they call social evaluative threat, threats to self-esteem or social status, where others can judge you negatively. That's what really gets under the skin and makes us feel tense. So very much the same story as I was telling you when interpreting those risk factors. So think of that as key, how you're valued in society. I'm going to skip some of these too. To understand this, I think you have to not only think about how adults become aware of social status, the quality of social relations, how important social hierarchy is, but you also have to think about how that gets into early childhood. You know, the early sensitivity in human beings that exists in endless different species, and in what it's about, what that early sensitivity, whether you're looking at cats and dogs or anything else, it's about the young adapting to the kind of environment that they're going to have to deal with. And in human beings, the important adaptive processes are how you adapt to different qualities of social relationships. Human beings have lived in everything from the most egalitarian hunting and gathering societies to the most awful tyrannies. And so, you know, am I growing up in a dog-eat-dog society where I must fight for what I can get and learn not to trust others because we're all rivals? Or am I growing up in a society where I will depend on cooperation, on reciprocity, where empathy is important? And that needs a quite different emotional and cognitive development. And it now looks as if there are powerful epigenetic processes which aid that adaptive process. This is what's happened to your, differences within institutions, within companies. You know, in the round about the late 70s, early 80s, CEOs were getting 20, 25 times more than the production workers. And then that escalated absolutely, you know, to 200, 300, 400 times as much. And why we've all become more unequal is the top have run away from the rest of us, not because the poor have fallen further behind. I do think that we must really deal with this not simply by the tax and benefits routes, but by, which means stopping tax avoidance, ending tax havens and so on, but mainly I suspect, through making people at the top accountable. More employee representatives on the board. Many countries have legislation about employee representatives on remuneration boards. I think in Germany, if there are more than 2,000 employees in a company, half the representatives have to be employees on remuneration committees. But also mutuals, friendly societies, employee-owned companies, cooperatives have much smaller income differences within them because of the influence of employees. I want, before I finish, just to tell you a little bit about the kind of ways we, through the Equality Trust, have been trying to reduce income differences, how we've been campaigning. A number of the Labour-controlled authorities, local governments in some of our cities, have been setting up fairness commissions. I've been on 2 of them. I've spoken to all of them as they were setting up. What they do is try and think how a city can reduce income differences within it, with the idea that if we can reduce the income differences in Liverpool or something, it becomes a better place for all of us to live. And they've done it by doing things like the local government leading the way, paying the living wage rather than the minimum wage, trying to extend that to the rest of the public sector, to health and education, to police and so on. And then also asking their suppliers, companies they buy from, about pay ratios, about whether they pay the living wage, and so trying to spread that different ethic. And now about 20% of local authorities throughout Britain are committed at least to paying the living wage rather than the basic minimum wage. Political parties, our stuff has got round, so the main parties have all mentioned our book publicly. Actually, David Miliband, the head of the Labour Party, asked his staff to read it. But we also tried to get into as many other institutions, particularly the charities dealing with some of the outcomes that we look at. So children's charities have made inequality an important part of what they campaign on. Drug charities, prison charities. Trade unions have been taking this up and have a pamphlet on why inequality matters that uses some of our stuff. The Green Party now makes greater equality as central to its manifesto. Then around the country, about 16 local equality groups are set up. The one in London is particularly active, it called itself My Fair London. And very effective campaigning. The Equality Trust produces research reports about the scale of income differences in companies. There have been some very nice, funny video virals. I haven't got time to go into those, but I'd love to show you them. Several documentary films are being made by different filmmakers around inequality themes and educational films. We have a research grant to produce educational materials for research, for work in schools teaching about inequality. You can download lectures and slides, these ones and others, from our website. And so please use any of them you want. But the most important thing, I think, almost of all this, is I was invited to give a TED talk. And I don't know how the TED people get so many hits on their website. But it's been more important than anything else we've done. That I was asked to do 18, they don't say 20 minutes, they say 18 minutes. And they make you rehearse and all sorts of stuff. But it's had over 1.5 million viewings now. Quite extraordinary. So let's turn our society from that, as miserable as it is, to something a bit more convivial. That's an Irish street party. Ireland isn't particularly equal, but they're having a better time there. So, more in the book about mechanisms and all the data for the American states and internationally, and the equality stuff. You can find things about campaigning. Thank you.
I'm Tony Griffin. I'm the director of the JMAX Bond Center at the Spitzer School of Architecture. As Michelle said, she's had the great opportunity to move Richard through the city and through the CUNY community over the last few days, and his last stop was visiting us at the design school. And so kind of what I thought I was going to talk about is a little bit transformed from a really engaging conversation that we had earlier this morning. But I think very much in the spirit of what Don and Michelle set up for us, in that these issues of equality and inequality are certainly multidisciplinary issues, and I think an interesting challenge before us is to how we tackle it in an interdisciplinary way. So you're going to have to forgive me. I re-scrambled my notes, and I'm going to be referring to them, but bear with me as I try to make a couple of propositions for you. One of it is going to be based in the kind of work we're doing at the Center on Design for the Just City. And then the second set of propositions is actually going to be based on a series of current events, most of which happened in November. So we'll see how that goes. So just a little bit of background. I'm at the School of Architecture. We have 4 core disciplines: architecture, urban design, landscape architecture, and sustainability. And for those of us in the design world, we probably talk about issues of inequality or equality in slightly different language. We talk about socially conscious design, we talk about advocacy planning, we talk about designing like we give a damn, and we talk about things like spontaneous intervention, this way with which we as designers don't wait for clients to present problems to us, but we see problems in the physical world and we take action to find innovative solutions for them. All of these kinds of issues sometimes bubble under the surface of design schools and are not necessarily really baked in a hardcore way into the curriculum. And so when I got the opportunity to start a center, I thought it would be really interesting and very much aligned with how I've practiced to think about this notion of the just city. And the just city is a term that I thought helped to encapsulate a lot of the things we talk about in terms of being socially conscious, but was abstract enough to allow us to have some really interesting and provocative conversation around what that means. So when we launched the center in May of this past year, we launched this informal civic engagement process. We created these little postcards that said, "The Just City Must Have." We got over 270 responses from a pretty broad range of faculty, students, folks like yourselves when we went out to lectures, and we even had a nice assortment of high school youth that we surveyed. And the results generally break down in this way. 43% of the responses made suggestions about what the physical environment should include as it related to a just city. 31% of respondents talked about different values like equality and equity, freedom, justice, connectivity, access, et cetera. And then 18% of them talked about kind of human well-being issues and things that a just citizen or person should have. And so we were in the middle of this when Michelle reached out and asked if I would be a part of this conversation, to which I immediately ran and got the spirit level and just thought it was so fortunate that there was this interesting intersection in looking very quantitatively at factors of human well-being and inequality, and how might we begin to think about issues of spatial inequality in the same way that Richard started looking at income inequality. So I'm super delighted to have had the opportunity to spend a good portion of my day with Richard and be exposed to his work. And we think that there's some interesting ways with which we might be able to think about his methodology and the way he's thinking about human well-being and how we as designers and others think about the physical environment, which I would submit as another sort of common intersection for interdisciplinary work. So I'm also delighted to be here at the Graduate Center. What underlies, I think, the way Richard and I think about our work in our various centers is this notion of income change and values. So, Richard set up a series of well-being metrics for us around trust, life expectancy, crime, educational attainment, obesity, et cetera. In parallel, what we've been doing is looking at some of the roots and consequences of some of our federal urban development policies, things like sprawl, abandonment, displacement, environmental justice. And when we do that, what was interesting in our conversation today was Richard really set up the way with which he's looking at the income gap, right? The income inequality, the highs and the lows, and how do you build a bridge that's vertical this way. But as we began to think about the way we think about that question in the design world, we realized that we spend a lot of our time thinking about income diversity, creating mixed income communities. Does it matter if rich and poor people live together? Does that begin to change aspects of human well-being? And while we didn't land on an answer to that, I just thought that was a very interesting aha to distinguish the questions as very separate and different. And so when we go forward, I think one of the things we want to talk about, and maybe this can be one of our discussion points, is does it matter which one we work on first? Because I think what Richard's work is doing is suggesting we really do need to take a first attempt at looking at this income change, this economic condition, because it has such intrinsic links to our human well-being. So, which one of these should we tackle first? Or is it a first question? Is it an either-or question? Is it a parallel question? And for us in the design school, our question is, can design of the environment affect that change, either the closing of the gap or the notion that income integration matters? And I think other disciplines in this room today might ask themselves the same kind of question towards this notion of an interdisciplinary approach to inequality. We talked, as example, about, in our world, the notions of the repositioning of public housing. There was a great movement over the last 20 or 30 years that we're trying to find ways to reposition what was thought to be very abysmal public housing, tall high-rise buildings set on super blocks that created certain social isolations for people, and a movement to move that to lower-rise buildings very intentionally with front porches and picket fences, and in some way adding market rate housing to that mix was going to allow people by sheer proximity to elevate their economic status. And there is a body of research underway to try to help us determine whether or not that really worked. I think a lot of us are very skeptical that it did. But on the other hand, as Michelle pointed out to us earlier, maybe when we look at another example of the co-location of maybe youth facilities, how young people and the various things they need within a school environment help to set up that same kind of proximity dynamic. And then the way with which that matriculates through how they grow into adulthood, how does that begin to increase their potential for better income, economic and income opportunities? So this is one of the interesting sort of takeaways from our discussion this afternoon, and perhaps we can spend a little bit more time on it today. I think the other provocation I'd like to leave as a reaction and response to Richard's work is, does being a richer country actually make it harder for us to address inequality? And so of the many kinds of lenses that Richard's work takes the reader through, there are three I'd like to sort of juxtapose against these current events. So the first one is this notion of consumerism and social mobility and Black Friday. So how many of you were kind of exasperated by the fact that either on November 1st after Halloween you went into your local CVS and you were confronted with fake wreaths of Christmas, or that before you even planned your Thanksgiving menu you were seeing commercials for Black Friday? I was exasperated. This notion of the promotion of consumerism and the effect that that has on, I think, the broad spans of our economic distribution equally is really quite interesting, especially when Richard points to the fact that just over 12% of our population living in poverty, 80% of them have air conditioners, or 75% of them own a car, or 33% of them own a computer or a dishwasher. So does this notion of living in a consumeristic culture that allows even some of the folks at the lowest realms of our income status to attain these things that richer countries can't, make it harder for us to have meaningful conversations and think about how to lift people out of concentrated poverty. And this notion of the epigenetics, I think that that creates, when you think about the work I did in Newark, for example, when I was planning director there, what I recognize is that the concentration of poverty as it was drawn in the 1961 slum clearance boundaries was almost identical to the 2000 census of concentrations of poverty. So if you do the math, that's at least 3 generations of families living in the same sort of culture of poverty. So there is this spatial implication of spatial inequality as well as social inequality when we look at the notion of consumerism. And that certainly is further fueled by our reality TV as we know it to be today, and even through the lyrics of someone like Kanye West, whose latest song on the radio, My Click, talks about how white people don't spend, they invest, whereas he buys things so that he can compare his Maybach to the former CIA director, George Tenet. So it's perpetuated in very interesting ways, and perhaps I'm wondering if this colors our ability to think really critically about the well-being effects of income and spatial inequality in our country. The second current event is our 2012 elections. We certainly had no shortage of conversation that began to expose and have really critical and open conversations about the income gap, the 99%, the 47%. And what I also thought that it did, looking at it from spatial lens, is expose the way with which sometimes we code the way with which we talk about income inequality. There were interesting stats, which I don't have before me, that talked about the few amount of times folks on the campaign trail or at the convention mentioned the word city or poverty, and how we sometimes conflate those things and we think about them somewhat simultaneously. Or how the Occupy Wall Street movement, which was about income disparities, led to further interesting conversations about the right to the city and the way with which we can use a public space like Zuccotti Park, which is actually privately owned public space. So again, there's this interesting connection between income and spatial inequality that we would hope to explore as Richard talks about poverty or inequality in his book. And then the last current event related to the notion of sustainability, which the Spirit Level speaks to, is our disaster events and our beloved Hurricane Sandy. David Rode with Reuters on October 31st wrote this really interesting piece called The Hurricanes Inequality, where he tells kind of 2 stories. He talks about the trifecta that Michelle talked about in terms of the income disparity that exists in New York State and in New York City. And he talks about, as a person of higher income mobility, having the ability to leave Lower Manhattan to seek refuge in Midtown at a hotel, and watching the people who were going out to try to find food and candles, who were the hotel workers where he was staying, were probably the people who were on the phone calling their families in the neighborhoods where the disaster was having the most effect. So the service workers who were a part of managing the recovery effort, and how he sat and watched the economy unfold as he was seeking shelter. And from a spatial standpoint, the conversations that immediately happened, certainly within my world of planning and design, about what do we do in the aftermath, and conversations that you would hear, or sound bites that you would hear from the likes of Governor Christie, who would support that it's really the private landowners who live on the coastal property who have the right to determine what they do, what they build, and when they build. However, when we look at contexts that are very similar to the 9th Ward in New Orleans, that wasn't the conversation. The conversation was not about choice. The conversation was, this is an area that should never have been built in the first place. So these, again, present some interesting expressions of both income and spatial inequality that we want to begin to pursue in our work, and I think that the Spirit Level gave us really interesting inspiration to try to pursue. So the last thing I'd like to leave you with before I turn it over to Michelle for conversation is a quote from Professor Sharon Sutton. Professor Sharon Sutton is a professor at the University of Washington and director of the Center for Environmental Education and Design Studies. And what I love about her is she's like me and Michelle kind of synced up together because she has a design background and she also has a background in social work. Not that that is your field of expertise, but close enough for me. She says that, and the reason why I want to read this, because I think one of the interesting things about reading the spirit level is that underlying, I think, all the way through, I believe that Richard and his colleagues are making a plea for a renewed sense of community and a shared responsibility for why equality matters. And so Professor Sharon Sutton writes, in the last century, we have witnessed a drastic increase in personal freedom, mobility, individual rights, and the reorienting of culture around individual needs. While this loosening of restraints on individuals has had many positive outcomes, it has simultaneously led privileged Americans to lose sight of struggling together in hard country, of being together in a place and a manner that has limits. Without such disciplined limitations, people have become incapable of addressing the harsh realities of poverty, greed, ignorance, and prejudice that are a part of the human condition. So I do think this notion of being a rich country with such stark inequalities, it really is a call to action for us to figure out what we can do in an interdisciplinary response. Thank you.